how much do you truly trust your healthcare? I mean, really think about it. From following your doctor's orders to deciding on a new vaccine, that trust, it's absolute fundamental. But here's the thing. This trust seems to be, well, eroding. And that's a huge problem for public health. It makes effective action almost impossible if people aren't on board. How do we even start to fix something if we can't properly measure it?
Yeah, that's been a major roadblock. We all know trust is crucial, but actually measuring it well, that's been tough. The tools we had were often, too narrow. They'd look at just one piece of the puzzle. Or they were just too clunky, too long to use easily in the real world, which made it really hard to figure out what strategies actually work to rebuild trust system-wide.
Okay, so measuring trust at headache. Got it. But I've heard whispers about something new, the S-TIMHSS. Tell us about that. What is it exactly? What's the main goal here?
Yes. It's quite exciting, actually. Yeah. Researchers developed this S-TIMHSS. It's an 18-item scale. Came out of work done in 2024, published just this April. Its main job is to give us one single integrated score for trust across 3 key areas: trust in doctors, trust in the health system itself, and trust in health policy.
Okay, 3 areas, 1 score. What's so different about that?
Well, the original scale, the TMHESS, had 38 items. It was really thorough, but it had this big limitation. You couldn't just add up the scores to get a total trust number. And comparing groups was statistically tricky, kind of like comparing apples and oranges, lots of detail, but no simple bottom line.
Ah, I see.
This new S-TIMHSS, the short one, fixes that. It gives a clear, comparable score, much more practical. And here's the kicker. It takes less than 3 minutes to complete.
Under 3 minutes. Seriously, that's incredibly fast. But okay, my first thought is, if it's that much shorter, does it still work? Does it capture enough? Is it still reliable?
That's the million-dollar question, isn't it? And the answer seems to be yes. That's where the careful development comes in. Even though it's way shorter, this 18-item S-TIMHSS keeps all the essential validity of the original longer one.
So it still measures what it's supposed to measure accurately.
Exactly. With the same level of confidence. They put it through rigorous statistical tests, got input from experts on the content, all based on data from 512 people. They really made sure it was solid before putting it out there.
Okay, so it's tested, it's quick, it covers doctors, systems, policy. Sounds like a really useful tool for policymakers, for hospitals. But how do they actually use it in practice? And maybe is there a risk they just focus on getting a good score instead of actually building trust?
That's a really important point about how it's applied. It can be a powerful quality metric. It helps design and check if interventions to rebuild trust are actually working. You could weave it into patient experience surveys, for example. It gives you richer data than just were you satisfied.
Right, goes deeper.
Yeah, like maybe the data shows trust is low because people feel judged by doctors or they worry about confidentiality. That tells you specifically what needs fixing, not just that something's wrong. And for the system leaders, it might flag bigger issues like long wait times or staff shortages that are chipping away at trust. But you're right. The key is using it as a diagnostic tool for real improvement, not just, chasing a number.
Okay, so pulling it all together.
Yeah.
What does this mean for you listening at home? Why should the average person care about an 18-item scale?
Because it connects directly to things that affect your health in the real world. Having greater trust isn't just some abstract idea. It's strongly linked to positive health behaviors.
Like taking your meds or getting vaccinated.
Exactly. Taking medication as prescribed, being willing to accept vaccines, things like that. It also correlates with having fewer symptoms and generally a higher quality of life. And think about the flip side. Low trust can mean people seek more second opinions, maybe delay care, or just disengage altogether. That can drive up costs and lead to worse outcomes.
Okay, so maybe to wrap up with a bigger picture idea. This research, beyond just the measurement tool, it feels like a reminder, doesn't it? That trust in healthcare isn't automatic anymore. It really has to be earned.
Absolutely. The COVID-19 pandemic, the flood of online misinformation, all these things have really highlighted what some people are calling a trust crisis.
Yeah, it feels like it's affecting everything.
So the ultimate goal here isn't just measuring trust accurately, although that's a huge step. It's about using those insights to genuinely listen to people and to make sure that our healthcare providers, our systems, our policies, that they are actually trustworthy.
So maybe a final thought for everyone listening. In this really complex healthcare world we live in, how do you define trustworthiness? And what role do you think a tool like this precise measurement, plays in shaping a healthier future?